can do. Jennifer, Jennifer, Mullendore, Mullendore. I'm the medical director for Buncombe County Health and Human Services.
And Dr. Mullendore, can you tell us, well, I guess we'll start, by saying, we can now say that, the Legionnaires outbreak is related in some way to the North Carolina Mountain State Fair.
Yeah, so of the cases that have been reported and investigated, there has been a common link to attendance at the Mountain State Fair.
Great. And it was mentioned to me over the phone earlier, that the case definition has expanded. What exactly does that mean, kind of in simpler terms?
So the case definition is how we determine, does this reported illness meet criteria to be counted as a case in this outbreak investigation? And so it puts parameters on does it have the clinical diagnosis of pneumonia? Is there lab evidence of Legionella infection? And was there attendance at the Mountain State Fair? If those things are met, we can then say, yep, that is a confirmed case.
So if someone has symptoms and it also happens that they attended the fair, what's the next step? Is there testing, et cetera?
Right, so we're encouraging people who have signs and symptoms of Legionnaires Disease and attended the Mountain State Fair to see their medical provider. There is a urine test that can be done to look for the antigen of Legionella bacteria, and with that information, that helps us confirm a case.
Now, typically, healthier people aren't, as at
Correct.
risk. There are certain demographics that are, but even with that in mind, I feel like this is something that people should take very seriously, no?
Right. I mean, again, the risk is greater in people who are 50 and older, people who are current or former smokers, people who have chronic lung disease like COPD or emphysema, and people who have weakened immune systems because of chronic medical conditions or medications they take. So those are the populations we are most worried about. But yeah, I mean, anybody who has signs or symptoms of pneumonia and attended the state fair, we would just encourage to follow with their provider.
So where are we right now in this investigation? You mentioned that they haven't found a source yet. Can you elaborate?
Yeah, so again, the commonality among these cases has been attendance at the Mountain State Fair, but where is the source of the aerosolized droplets, which is how Legionnaires' disease is spread? And so that investigation is ongoing with the North Carolina Communicable Disease Branch and the fair organizers who are assessing maps of the fair, what vendors might have had setups that put aerosolized droplets in the air. So it's an ongoing investigation.
Sure. Have the folks from the fair, maybe hinted at anything? Did they say, hey, maybe we can investigate this portion of it because there was stuff here?
I mean, I think that they're working together with the Communicable Disease Branch to identify every possible source, and then the investigation to connect with the people who had those sources is happening as we speak.
Now, right now we're sitting at 9 confirmed, 1 fatality, obviously. So any increase would get us into double digits.
And that 9 confirmed is Buncombe County specific. We do know of other cases in other counties. And so, yeah, we're expecting the case count to go up more.
And you said Buncombe County specific, so now I have
Right.
to ask, is it anticipated that with these other cases that, you think are out there, that it, overflows beyond just Buncombe County?
Oh yeah, I mean there have been reports to the state of other counties seeing or getting reports of similar cases. The investigation of those is ongoing, and I can't speak directly to those since they're not our county.
Sure. I mean, does that concern you at all? What is the potential scope for this outbreak here? I mean, a lot of people could have been through the state fair.
Yeah, we know a lot of people did go through the state fair. I mean, there are attendance numbers for that. So yeah, I mean, I think again, if we are able to narrow down and get source information, that will help us a little bit. But yeah, the potential is great. We do know that the incubation period for being exposed to Legionella bacteria and getting sick with Legionnaires' disease we're coming upon the end of that incubation period, so within the next several days, we should be seeing these reports decrease.
Gotcha. Legionnaires isn't necessarily something that is super common, found in every day, so, I mean, is this in a way surprising? Is it kind of bizarre that, this weird set of circumstances befell some people at this fair?
I think that, typically we see outbreaks of Legionnaires disease associated with buildings and cooling towers, but anything that can aerosolize the bacteria into water droplets, it's possible. So it is a bit different than our typical setting for an outbreak, but.
So what can we expect, later today from the state, and then that trickles down to the county? Obviously, what are we anticipating?
The state is getting reports from all the counties, and they are planning to release a case count for the entire state later this afternoon, and then counties may also do that, just to kind of keep the public up to date on the numbers.
Obviously, we're kind of right here on that two-state line. I mean, could we potentially be talking about people from South Carolina as well?
Absolutely. People from all over go to the fair. Yeah, and so the communicable disease branch has been pushing communications out to through their channels to make sure that people across the state, as well as in local jurisdictions outside of the state, are aware.
What haven't I hit on? What else do you want to put out there and make sure that our viewing audience knows? I
think that people who attended the fair are getting worried about the potential for them to get sick, and I would again have people focus on that typically healthy people don't develop Legionnaires disease, and that it's really development of the symptoms, so cough, extreme weakness and fatigue, shortness of breath, headaches, those sorts of things. If you develop those, then it would be appropriate to contact your doctor. But until then, most of us who attended the fair, we should be okay. And I would also encourage people to just ask questions of their medical providers, read the information we're sending out so that they fully understand the risk.
Understood.
Have you gotten anything from the public? Any responses from the public at all yet?
Yes.
People who are worried?
Yes.
What can you say to that?
Again, I think it's the same thing. It's like they're like, oh, I went to the fair and I'm worried I have Legionnaires disease. And so trying to make sure that they understand what is their risk and what are the symptoms. And if they have symptoms, the recommendation is to go to their provider.
Has that call volume been large? Or?
I don't know, not blowing our phones up, but we've had the cases, and I know that people are putting stuff out on Facebook, and
So you just want to keep people.
Yeah, try to again, like I was talking earlier, we're coming into flu season, right? People never get upset about. It doesn't seem like most people get upset about the flu, and you're much more likely to die from the flu, even as a healthy person. And so, again, we're not great as humans as judging risk, right? You got in a car and drove here today, and that's a risky thing you just did, right? I flip out when I get on an airplane, but I'm more likely to die in a car. So that whole risk assessment.
Yeah.
And so trying to we want to share information with the public, not create hysteria, sure. Finding that sweet spot, which is kind of your role as well, right? Inform, but not.
Yeah.
So if you have any ideas on that.
We'll certainly do our best. Yeah.
Yeah.
Well, thank you so much.
Yeah.
Really appreciate it.
Yeah.
Thank you for your time.
Yeah.
And just let us know if there's anything else that we need to be aware of.